Hi, my name is Erin Summers. In October of 2012, I was finally diagnosed with Ehlers-Danlos syndrome. I'd been waiting for my referral to the Wasser Clinic for a year as my symptoms kept mounting. My doctor, who is here today, walked in the room and immediately suggested I had Ehlers-Danlos syndrome because I was curled up in the fetal position on his examination table. By this point, this was the only way I felt comfortable, and My symptoms began when I was born with a reflux kidney and subsequent chronic urinary tract infections. More symptoms developed as I grew, including migraines, back and joint pain, gastrointestinal complaints, and even blackouts. I was able to make it into McGill University and even make the varsity figure skating team, although that was very short-lived. Eventually, I could barely keep my head up, and I was forced to quit school and quit my job and skating. My mother began taking me to all types of doctors looking for answers. In the next 2 years, I saw about 30 doctors and racked up almost as many diagnoses, including interstitial cystitis, gastroparesis, celiac disease, gastritis, POTS, dysautonomia. I tried every treatment I was offered, and I often had no relief. I was accused of having an eating disorder, being overly sensitive, or told it was in my head. I even had a doctor suggest that I was physically and sexually abused. As my clinical picture became more confusing to medical professionals, I began to lose hope that I would ever find help. With the EDS diagnosis, my enthusiasm for the diagnosis quickly turned to frustration when none of my existing doctors had even heard of EDS. I began researching online from sites like the ILC and the EDNF in the US. I even went to a support group in Toronto and read patient accounts online. It was amazing to finally see other people with the strange array of symptoms that I had, and through my research, I was able to learn about Dr. Henderson and the treatment he was doing with EDS patients. My GP informed me that we could not do the diagnostic testing in Canada for some of the complications that came along with EDS, and we sent in a referral to Dr. Henderson's office. I learned from the support group that it was near impossible to get OHIP to cover the diagnostic testing, let alone the surgeries, but I was lucky enough to have the support of my parents who were willing to pay to get their daughter back. By the spring of 2013, I was extremely ill and scared to death. I'd suffered a concussion from a car accident at the beginning of April, and my symptoms had progressively increased. I was no longer able to keep any food down. I was blacking out up to 40 times a day, in constant pain and unable to care for myself, being forced to use a wheelchair out of complete exhaustion. I saw Dr. Henderson in May of 2013, and he did the upright MRI and rotational CT scans, from which he diagnosed me with a lentil axial subluxation and the tethered spinal cord. On July 15th of this summer, I had my C1-C2 fusion with Dr. Henderson, and I was released the very next day from Doctors Community Hospital. The searing pain in the back of my head was gone. I saw clearly for the first time in years, and I was able to walk around and sit without getting completely dizzy and confused. On August 21st, I had my spinal cord untethered by Dr. Henderson, and I've been able to eat solid food, get off my motility agent, I've gained weight, my back pain has diminished, and my urological complaints are half of what they used to be. Even the big birthmark on my back seems to have disappeared. At this point, I'm still in shock that I have some semblance of a life back. After years of refractory treatments and being bedridden most of the time, I never thought I'd be able to get better. I'm so grateful to Dr. Gordon for giving me the EDS diagnosis and for Dr. Henderson for giving me my life back. I know not everyone can afford to go to the States for treatment, but hopefully, with more knowledge of EDS and the complications that come from it, we will be able to diagnose and treat people here in Canada. I just hope that others can have some of the same relief that I did.